Would you want your face to look like this? What about your hand to look like this? These are pictures of skin cancer. Skin cancer is the most common form of cancer, but the good news is that it is often preventable. Skin cancer is when malignant or cancer cells form in the tissues of the skin due to the relationship of cell division and cell differentiation becoming distorted. And more than 90% of the cases are due to sun exposure. About 1 million Americans develop skin cancer each year, and it is more of an issue now than ever before. The decrease in ozone levels allows more UV or ultraviolet radiation to pass through the Earth's atmosphere and reach the surface, which puts us all at a higher risk for skin cancer. There has been a 3% to 8% yearly increase in incidence of non-melanoma skin cancer since 1960 worldwide. You put yourself at a higher risk for skin cancer being out in the sun during the day, whether you're working, mowing the lawn, having a pool day or a beach day, or gardening, or anything else that you might do outside, especially between the hours of 11 a.m. to 4 p.m. when the sun's ultraviolet rays are the strongest. Since most of our outside activities we either don't want to give up, like our pool or beach days, or can't give up, such as mowing the lawn or working, I want you to wear sunscreen, because the use of sunscreen helps prevent skin cancer. When I say wear sunscreen, I do not mean put it on once in the morning and forget about it all day. Sunscreen needs to be reapplied at least every 2 hours to maximize your protection, especially during the summer months when the sun's ultraviolet rays are the strongest. I was a lifeguard for 2 summers, and I learned within the first week that sunscreen protects my skin against damage caused by high ultraviolet rays, like the sun. I realized that the more I reapplied sunscreen, the healthier my skin looked. It didn't peel, it was smooth, and it was healthier. I was protecting myself from skin cancer. One study found that wearing sunscreen can help prevent actinic keratosis, which are scaly patches of skin that sometimes become squamous cell carcinoma, which is one of the most common forms of skin cancer. Another study done by the Johnson & Johnson Company tested 12 people, both male and female, from the ages of 33 to 59 with different skin types for the effectiveness of an SPF, which is a sun protection factor, 55 broad spectrum sunscreen lotion, and concluded that the sunscreen provided proportionally high protection against multiple cellular damage. Now, I know what you may be thinking. Why would I waste my time in the sun or take a break from having fun to put on sunscreen? Well, think of it this way. You can take 3 minutes every 2 hours you're in the sun to reapply sunscreen, or you could risk cutting your life short to melanoma, one of the most serious forms of skin cancer, or take months of recovery from a surgery. So, which do you prefer? 3 minutes every 2 hours, or no fun in the sun for months recovering from surgery? Or maybe you just want to avoid the sunscreen and get a healthy tan, but there's no such thing as a healthy tan. Tan skin is damaged skin. Even if you don't get a sunburn, you're still doing damage to your skin. and increasing your risk of skin cancer, because a tan is just the body's attempt to protect itself from the sun's harmful rays. If you don't use sunscreen, you're putting yourself at risk for skin cancers, including the two most common types, which are basal cell skin cancer and squamous cell skin cancer. Basal cell estimates 2.8 million cases per year, and squamous cell estimates 700,000 cases per year. Or the most dangerous, melanoma. Many treatment options are available for non-melanoma skin cancers, like basal cell and squamous cell cancers. They include procedures like removal by cryosurgery, which is the process of freezing the lesion with liquid nitrogen, curettage and electrodissection, which is scraping the lesion and the destruction of any remaining cancer cells with an electrical current, or Mohs surgery, which is the removal of a lesion layer by layer down to normal margins. The treatment for melanoma is a wide surgical removal of the melanoma. And also includes the removal of the surrounding tissue and any affected lymph nodes, followed by skin grafting, which is the process in which a piece of skin that is taken from a donor area, like the leg or the knee, replaces the skin removed during surgery. When I was a New Vision student, my senior year of high school, I actually watched the surgery be performed. I was following a surgeon in the OR. The patient had melanoma only about 0.5 centimeter in size on their arm. I was shocked at how wide the surgical removal was of the surrounding tissue. I also watched the surgeon remove the lymph nodes from the patient's armpit that were connected to the lesion. It was a huge eye-opener for me, and I have used sunscreen regularly since then. If you use sunscreen regularly and reapply, you are protecting your skin from harmful ultraviolet rays and lowering your risk of skin cancers like basal cell, squamous cell, and melanoma skin cancers. So, use sunscreen! You should put the sunscreen on at least 15 minutes before you go into the sun. A sun protection factor, or SPF, between 15 and 50 is considered good protection if applied often. Try to look for sunscreen that is sweat resistant or water resistant. It can be overwhelming sunscreen shopping because there are so many different brands that vary in ingredients and SPFs. If you are looking for which sunscreen brand to use, a field study tested 10 sunscreen brands on 12 children between the ages of 2 and 4 years old and found that Banana Boat SPF 30+ with 6% titanium had the highest absorption over 4 hours, concluding that Banana Boat provided the most ultraviolet protection compared to the other 9 brands. So put the sunscreen everywhere that the sun's rays may touch you. Whether you're using a spray or a lotion, be sure to rub it in. Have someone else apply hard to reach areas like your upper back. This includes your arms, your shoulders, your chest, stomach, legs, feet, face, and don't forget about your ears, the back of your neck, or any bald spots that might be on the top of your head. These areas are often forgotten during the rush of putting on sunscreen, but they are very important areas. And remember to put more sunscreen on at least every 2 hours and after swimming, sweating, or toweling off, and you will be protecting yourself from the sun's ultraviolet rays, and your skin will thank you.